I suppose I opened by saying, during my period as Minister for Health, I said at many a conference that politicians were to blame for a lot of the lack of progress in many areas, and in particular health. One of the reasons being that it is much more politically attractive, or sexy if you will, to open an MRI scanner or a new hospital or a new primary care centre than it is to implement a public health initiative that will save many, many more lives on an ongoing basis for generations to come, long after the hospital ceases to be or the MRI ceases to work. This is one such piece of legislation. And I want to say, notwithstanding some of the strongly expressed opinions about certain elements of the debate tonight, I think it's been really good. And I think it's very good that we've all had our say and that people have offered different views. And I particularly look at Senator McDowell, who would, probably allude to me as being a bit of a zealot because of my earlier contribution, when nothing could be further from the truth. I welcome the fact that we have lobbyists. I respect the alcohol industry. I don't say that alcohol is the same as tobacco, insofar as that one can drink reasonably and one will not suffer ill effect. But every cigarette does damage. However, there are many similarities, even between the two products, in that alcohol is a poison if taken to excess, and that we have got the term alcoholic poisoning as a cause of death, and that's a fact. And sadly, the alcohol industry bears a lot of resemblance in terms of the tactics that they're using to the tobacco industry, up to and as late as a few weeks ago, where we had their representative telling us that alcohol was not a carcinogen, when the WHO have proven beyond any reasonable doubt that it is. And I'm not going to repeat what I said earlier on in relation to the illnesses it causes. I think a critical part of this bill, Minister, is the wording around not readily visible. And I think that's essential. And I disagree with those who say that won't make any difference, because even the old Irish proverb is there, or the adage, what the eyes don't see, the heart won't grieve for. It's a well-known fact. And we've had one of our speakers talk about it being put beside the cash register to attract your eye, so you buy that product. We had all this discussion in relation to sweets and chocolates and other things that were put at the eye level of children. That was done very purposely because research showed that it sold more goods. Now, what this bill is about, and I respect your view, Senator, is about children, in my view, in the main way here. In the same way as kids been addicted to cigarettes by the time they're 18 years of age, 78% of smokers start, many of our young people have already formed the habit of drinking alcohol by the time they're 18. And that's a fact. And what we have to do, and what this bill is about primarily from my point of view, is protecting children from that. And I will disagree with those who say that we shouldn't be trying to denormalise alcohol. I think we should, particularly from a child's point of view. And in the same way as we wouldn't dream of asking a child, because it's illegal in any event, to go around and buy 10 fags, you can't buy them now, you can only buy 20s, we wouldn't ask them to go around and buy a six-pack, which we would have done 10, 15, 20 years ago. And when I talk about 10 and 15, 20 years ago, you could say alcohol is hugely addictive. We know that. But if they want further evidence, 20 years ago, many corner shops didn't sell alcohol. Now we're told they can't survive without it. So, I think we have to have concerns for small retailers, of course. And I'm very pleased that the Minister is now going to speak to all the stakeholders. But I hope he speaks to all the stakeholders. And by that I do mean the Irish Cancer Society again. I do mean Alcohol Action. I do mean the Children's Rights Alliance. I do mean Bernardo's. And I do mean those who are in organisations like AN who have been the victims of alcohol, what it's done to them and what it's done to their family. And the domestic violence that has come from that as well. I just want to say that I support the Minister. And I also believe in pragmatism, and we cannot let the perfect get in the way of the good. There are hugely important and good things in this bill, as others have said. Minimum unit pricing is proven to work. The advertising restrictions are key. as they have been in other areas. Visibility, education, they're all part of that. And I know from what others have said that there's been concern about cross-border. Both Minister Poots, when he was Minister for Health, and Minister Wells, who succeeded him, were both of a mind that we would have cooperation in both this area and in relation to tobacco across the border. But as I said earlier, sometimes you have to lead, not follow. Scotland did it. I believe we can do it and we should do it. Now, to those of us here who are elected representatives or were elected representatives and are elected now by a different group and who might want to go in front of the public again, you've all been lobbied very heavily. And again, the alcohol industry coming at it, not directly head-on, but using others as proxies, talking about jobs, talking about the small retailer, when all they're really concerned about is sales of goods and the bottom line of a profit margin. Now, I have two things to say to that, whether it's alcohol or anything else. It should never be a case that we in this House as legislators should put livelihoods ahead of lives, or should put jobs ahead of the well-being of our people. And I know that nobody wants to do that. And I respect that people have different views, but this is a very important piece of legislation. The Minister needs our support. I believe the bill of itself deserves it. I believe he deserves it too, for the amount of time, energy and effort, and the fact that he's here himself doing this shows his commitment to it. But as I said, to those who would want to go before the public again, bear this in mind from Health Research Bureau, that 85% of people surveyed in a survey of over 1,000 felt that our consumption of alcohol in this country was too high, that 73% felt we tolerated too much, and that 58% think the government and the legislature and us are not doing enough about it. So let's not let those facts go unnoticed, and let's go ahead and be seen to take action and be remembered as people who did put the well-being of our people, and in particular our children, first. For what good are jobs if you lose loved ones through ill health and suicide? And what good is wealth if you have a society riven by domestic violence? I commend you, Minister, on your determination, and I commend your department for its ongoing commitment and unstinting determination and resolve to see this through. I hope your consultations go well, and I hope you'll be back here to this House before Christmas to deliver the children of our nation a Christmas present in the form of this bill. Thank you.